Hello, everyone. I am Michelle Melville-Cashan. I am the Community and Content Director at Sexual Health Alliance, and today I'm with Dr. Rena Malik. Dr. Rena Malik specializes in reconstructive urology, sexual medicine, hormone management, and pelvic pain. She is regularly featured by media outlets, including Insider, Men's Health, Self, Scientific American, Bustle, and U.S. News and World Report. Has an active YouTube channel providing urologic education with over 2 million subscribers and 300 million views. She is passionate about dispelling medical misinformation. She was awarded Top Doctor between 2019 and 2022 by Baltimore Magazine for Urology and Urogynecology, and the AUA Young Urologist of the Year Award in 2023. She has published over 80 peer-reviewed articles and book chapters. Welcome, Dr. Rena Malik.
Thanks so much for having me.
Yes, thanks for being here with us today. Can you tell us a little bit about your presentation topic for the weekend event? This Girl is on Fire online Menopause Exceptional Weekend.
Yes, so my presentation is sort of an introduction to why we need to optimize hormone health. Like, what is the value in terms of improving your hormone health, and how can it improve your quality of life? And so that's really what we're trying to get across here, is that there is so much within our power that we can do to improve our hormone health with pharmacology, without pharmacology, and everyone needs to know this information.
Yes, I love that. That's going to be so educational for our audience. So tell us, what are some of the top concerns that you see in your practice?
Yeah, so I see a lot of people with sexual dysfunction. And so what that means is, for women, it can be things like low desire, which is very common. I see pain with sex or discomfort with sex. And then, of course, changes with hormones. So people will start having hot flashes. They will start having disruptive sleep. They will start having bone loss and things that occur during the time of, even starting as early as perimenopause. And so I see a lot of that. And there's a lot of challenges, unfortunately, for women in getting the care they deserve and the care they need. And so by the time they've seen me, they've been told, oh, it's nothing, it's all in your head. You just need to reduce your stress, which of course we all need to do, but that's not really enough to help people. And so I think it's important to take time with our patients, to spend time with them, to really understand what's going on and how we can support them during their challenges and get them better.
Yes, yes. So tell me, do you have a favorite issue to treat in your practice?
Yeah, I love treating women who have hormone issues, and that can be with desire as well as issues with pain and discomfort with sex, because we really do have some wonderful treatment options available now. And I find that once we figure out what works for you, and that's so individual, it might take some trial and error, but we can transform people's quality of life. And I think people forget how important sexual health really is, because when you feel like you can have sex and you can feel good and you can feel desire, like you feel like yourself, and a lot of the stressors in your life go away, because now you're able to relieve stress by having sex and being intimate with someone, and even intimate with yourself. It doesn't always have to be another person. And I think that that's really transformative for people's lives, and they don't really realize it until they're on the other side of it.
Yes. Oh, I love that so much. That is so true. So tell us, have you ever had an aha moment, or like your biggest aha moment in your practice?
Yeah, I think it really came when I realized, after seeing so many women, is that they just got ignored, and they just got told, like, drink a glass of wine, it'll be okay, or you just got to live this. And I also treat men, right? And when men have a problem, they get taken seriously. They get medications, they get surgeries covered by insurance to help them have erections. And it's crazy to me that we make it such a priority for men, that this is such an important thing, but who are they having sex with? And like, why are we ignoring that side of the coin? Why are we saying we just don't know what to do? It's more complex, it's more complicated. No, it's not. We just haven't given it the attention it deserves.
Right, right. And it's time. It's time we give women the attention they deserve, for sure. All right.
Absolutely. Yeah.
Yeah. So, okay, I know the answer to this one, but do you think it's important for urologists and healthcare professionals to receive additional sexual health training and information?
Absolutely. Now, you don't have to be a sexual medicine expert, right? I don't think that that's what I'm trying to say. What I'm trying to say is that everyone needs to know the basics and really how to communicate with people about sex because you might not have the answers. You may not have the tools in your toolbox to help the patient, but to be able to, give them agency and make them feel like they're heard and then send them on to someone who really can help them, that can be so helpful. And I think doctors and healthcare professionals, we tend to have a really hard time saying we don't know and passing and then knowing what to do if we don't know what to do. And so like I think that's really important is being like, you know what, you can't know everything. And it's part of our job to find someone who can help you with something. So if I can't help my patient with something and I don't know someone who can, I will do my damn best to find someone who can because that's my job.
Yes. Oh, I love that. And that's part of the Sexual Health Alliance origin story is we realize that so many professions do not receive training on sexual health or adequate training. It's like a few hours or one day or a small chapter in a book, and so we're here to support professionals across the board in medicine, therapy, counseling, coaching, education, just to provide people the services they need.
Yeah, absolutely. It's great.
All right. So if you have one tip or takeaway for our audience related to issues you've treated, what would that be?
Ask. Ask questions. So, whether it's you're dealing with an issue or your patient is, or whatever, you have to ask. And if you don't ask and you don't get the answer you want, keep asking. And so, whether it's you're the person who needs help, if you're not getting the answer you need, look for a second opinion, a third opinion, a fourth opinion until you find the person that really gets it. And for you as a person in a relationship, talk to your partners about sex. Like we were not taught how to talk about sex. And it makes sense that it's going to be awkward. It's going to be uncomfortable. It's not just one conversation, it's going to be multiple conversations over time that start making you feel more comfortable and until you can actually see changes that make a difference. And really, that's the most powerful thing you can do for your sex life.
Yes, that is such a great tip. Thank you. All right. Well, if you would like to hear more from Dr. Rena Malik, you can attend our online weekend. This Girl is on Fire Menopause Online Sexceptional Weekend happening this month, January 2025. It's happening on January 25th and 26th. It's an online event and you can attend live. There'll be chances to ask questions. It's going to be really great. I'll have the link below in the description where you can purchase tickets to the event on our website at sexualhealthalliance.com. Well, thank you again for joining us.
Thanks for having me.
All right. Bye, everyone.